Welcome, Lesha. I'm so excited to have you here on our Spotlight series for the Best in Utah Public Health. And we'll dive into all the questions after I read your bio here for the audience, and then we'll get started.
Awesome. Thank you so much.
Yes. Okay, Lesha is a pre and perinatal somatic practitioner, advanced cranial sacral therapist, occupational therapist, and postpartum doula. She specializes in somatic trauma resolution and bodywork for preconception through postpartum, including newborn care. She trains birth workers on topics such as attachment, nervous systems, and trauma-informed care. Currently, she is a teaching assistant for the Center of Pre and Perinatal Programs supporting mental health practitioners and midwives to deepen their education in somatic trauma resolution and birth. Her work is rooted in the nervous system healing and attachment theory to address mind, body, and spirit. She has worked for over 15 years in trauma-informed care, empowering people with evidence-based practices, as well as the tools they need to learn to listen to their own intuition and deep-bodied wisdom. Oh, amazing stuff, right? So right off the gates, what made you decide to get in this line of work? Like, how did this transpire?
It's been such a journey, and especially because, I'm a lifelong learner and will always be a lifelong learner. So I keep being like, oh, I'm an occupational therapist. Oh, I'm a cranial sacral therapist. Oh, I do perinatal somatics. So it's been a long journey, and I just kind of fell into occupational therapy at the time. I really wanted to go to graduate school. I knew I wanted to be in the health field, and I landed on occupational therapy because I felt like it was a very good bridge between medical world and medical understanding, because there's definitely a foot in that area. But it also really looked at the whole body and encompassed spirituality and spirit sometimes as well. And I really liked how it encompassed both. And we were kind of the bridge in the hospital between the person and the medical providers. So that's how I landed in occupational therapy. And I worked locally in inpatient neuro rehab for years, loved neuro, and really got a great understanding of the brain, the body, nervous system. And I happened to get a job at Primary Children's unplanned. They had an opening. I had a friend say, I know you love neuro stuff. I really think you should come up to Primary and work with me. And I was like, no, I don't work with kids. I don't do babies. Babies scare me. This is not my area. And about the same time, I was just starting to learn some cranial sacral therapy techniques through an organization called the Upledger Institute. And at my interview at Primary Children's, I told them, well, I do cranial sacral therapy. And they were like, you're hired. And I was kind of like, well, I don't know if I want to be hired. I don't know if I want this. So they had me come in and shadow for a day. And within the first hour, I was like, oh my God, I love this. This is just where I want to be. Working with the kids and with babies and in that environment was just amazing. It was one of the best jobs I ever could have asked for or had. And so that's kind of what opened the door to pediatrics itself and to working on infants and newborns. And they approached me and said, we love that you do craniosacral therapy, but logistically, we need on file that you've had training specifically for pediatrics. So I was like, okay, I'll go get my pediatric craniosacral therapy training. And did the pediatric courses and did the pregnancy courses and the newborn courses within the Upledger Institute. And that is what opened the door to me working with pregnancies and with babies. And I'm so lucky because I just was able to immediately start putting into practice the craniosacral therapy techniques to every client I saw up at Primary Children's, and every age, every baby, from very complex medical trauma to very simple trauma or medical issues. I was always incorporating craniosacral therapy into my practice, and kind of grew my own practice on the side at the same time. And a couple lactation consultants found out, excuse me, that I do craniosacral therapy and I work on babies, and they started sending me babies to my private practice. And it just grew. It exploded. At the time, this was probably 10 years ago. I was one of the only, I think honestly, the only one in the Valley that did craniosacral therapy on kids. I know, and babies. And so my practice just grew really fast and made the hard decision to stop working at primary children's and just focus on my own practice, and have eventually then opened that up into more somatic processing and somatic work as well with pregnancy, and really made the decision in 2020 with COVID. I think a lot of us went through some soul searching and some big changes at that time. And really decided I am going to only focus on pregnancy and birth and postpartum and newborns. Like I'm not, I was still seeing other things like back pain and concussion, and I decided to filter that out and just be like, this is what I'm doing, this is what brings me the most joy, and really followed that.
Amazing, incredible story through all that. So what do you feel like makes you different in the line of work that you do?
I really feel what makes me different is the fact that I do have all these separate trainings, and I kind of pull in each of the different pieces. And so someone might come to me with their newborn and we're doing cranial sacral therapy. Someone might come to me because they're pregnant and we might be doing some somatic processing or cranial sacral therapy or occupational therapy, even sometimes looking at, what are their activities of daily living, or are they happy with what they're doing in their life. And I really just trust each person will get what they need, whether it's cranial sacral, whether it is more somatic, whether it's a blend of both. And a lot of my pre and perinatal somatic training, we look at the baby's experience. So that education, we specifically go in and look at our own births and what that was like for us from preconception through postpartum for us as babies. And going through that process and feeling that in my own body really created an understanding and awareness of the baby's experience. And so that's a really unique approach for someone to come into my office, that when I am working with an infant, I'm really looking at their birth as to what they went through, and whether it was like a fascial restriction or a strain or a stress or a trauma, how to work with a nonverbal human working through trauma is very different and very unique in my line of work.
Incredible, incredible. Okay, so given all this great information, who is an ideal fit for you to come in? Obviously, newborn babies, moms, things like that. Are there certain ones that you're like, these people really need this, or like kind of give us that scope of like who's the ideal person to come in and see you?
Yeah, I think, having an understanding that the way I work and the way somatics works is that someone that just wants to lay on my table and not participate doesn't really work for me. Sometimes we need that. Sometimes once in a blue moon, we're doing some cranial sacral and the mom or the birthing person just really needs a nap and needs to check out. And I get that. But whether it's you're preparing for pregnancy or you're processing your birth, most times there's conversation and there's talking. And so someone that wants to work with me needs to understand that, like, we're talking and we're doing processing work and we're getting in tune with our body. So just having an understanding that mind, body, spirit's connected. And that's the type of client that I think is great and that has that belief or wants to work towards that whole body connection.
Amazing. Yeah, I love that. I think that's super important to like know what you're getting into and what you need to be prepared for the type of services you're going to receive. So awesome. Okay, what does the process look like to work for you? So like, say someone listening here, they're like, "Ooh, I want to work with Lesha." How do they work with you?
Yeah, so anyone can go to my website, book a session. That's easy. I offer quite an array of services and offerings. So whether it's one session and you come into my office and you do one session, whether that's for pregnancy, whether that's for your newborn, whether that's for you in postpartum. I also offer packages of sessions of 12. And so if someone wants to do deeper work, and I'm really open that, say that package of 12, like right now, that package of 12, I'm working with mom and dad because they both wanted sessions. And sometimes I've done like mom and baby in that package of 12. So there's a lot of flexibility there. And then I also do some in-home postpartum doula care, and I put that in quotes because it's more or less me coming to your home in the early postpartum period to do body work in home, and whether so that you don't have to come to the office, and those are in packages as well, but it's really focusing on the birthing person staying home and not having to leave to go to appointments. And those can look like, I'm working on baby, I'm working on mom. We'll do, sometimes we do yoni steaming, sometimes we're doing abdominal massage. It's just really catered to the birth itself and what the person wants and desires. So all of that, I have a free 30-minute consultation call. People can set up with me. People can text me. Texting is like honestly amazing because it's quick and I can text between clients. So the best way to contact me is my website. Text me, jump on a call with me, jump on a phone call. It's pretty open.
Awesome. Awesome. Okay. Now we're going to switch gears and talk a little bit more recovery. So what does recovery mean in your clinical ethos from pregnancy to postpartum and that transition, whether that's for mom or baby? Just dive into that.
Yeah. So I've just found that every baby is different, and sometimes a baby needs one session, and it kind of depends what's going on. I honestly think every baby could benefit even from one session post-birth. And research has shown, and osteopathic research has shown, that something like 80% of babies have an issue at the occipital cranial base in C1 post-birth. And that's just normal. And that if we can address that right away, it can lead to better outcomes for latching and for attachment and for sleeping. And so, of course, I'm like, every baby should just have one session. And then sometimes there's some birth trauma. So whether there's forceps used or suction, or I've heard and seen so many things that I don't want to trigger your viewers and your listeners. But sometimes those babies need a little bit more support. And some signs might be like they're just fussy, they won't settle, they seem uncomfortable in their body. Yeah, they're like tight. And sometimes people will be like, oh, my baby's so strong, it's holding its head up and it's rolling over and it's 2 days old. And I'm like, that's not strong, that's tight. So those are some things to kind of watch for. And usually after one session, I can get a sense of like, yeah, we need 1 or 2, 3 sessions. Most babies do not need more than 4 or 5 sessions. Sometimes if a baby is having oral restrictions, which is happening more and more these days, which is where there's tightness in the mouth, or sometimes the tongue is tied with this frenulum, or the lips tied, or we're starting to see a lot of cheek ties. We're starting to see a lot of mouth breathing and really narrow palates. And that's hindering a lot of latch and relationship and connection issues.
Do you know why
So
that's happening? This is not scripted on here, but I was like, why is that happening? Why are there more of this happening?
Yeah, there's a couple different theories about that. And I just I have some that I'm like, yeah, that resonates. And maybe I'll share the ones that resonate, but I don't know if this is happening more. I actually think this was happening for my generation. It just wasn't caught. Piecing all this together and knowing my body now, I have a very small palate. It's narrow, it's shortened. I have a subtle line down the center of my mouth. That's my 2 bones kind of formed. This is drastic, but they kind of formed like this instead of like this, which can happen from bottle feeding, inappropriate latch from sucking, pacifier use, which was all me. I wasn't breastfed very long because my mom got mastitis. So I had a lip tie that I burst when I was 8. So all of these things, I think this was already happening. We just didn't know. And when I was born, I'm in my 40s, it was actually pushed upon more to do bottle feeding. It was a lot more about like women working and women independence, and not that's not happening now, but the push more now is for breastfeeding. And so we're seeing these issues. And I'll just drop the name Dr. Weston Price. There's a really good book by him. It was written in 1930. It's like a textbook, very boring to read. But he was a dentist that basically said in the, I don't know what year. He basically predicted this happening, what's happening now, which our jaws are shrinking, our palates are getting smaller, we're having a lot of teeth decay and a lot of teeth issues, and we're seeing oral restrictions. And he was off by like 30 years. It's happened later than when he said it would. But basically, his book comes down to nutrition and what we're feeding and what we're eating and our mineral depletion. And so we know that if you have lack of vitamin K, that can actually lead to smaller palates and jaw issues. And that's like just one small nutritional thing. And when we look at our mouth and our teeth health, we actually need to look at our maternal line grandmothers. So when I think about my maternal line and my grandmother, I look at her health and what she was eating and what was happening in her life. And I'm like, oh yeah, no wonder I'm minerally depleted. Like, no wonder I'm having these issues. And I grew up off and on vegetarian for many, many years. So like, there's just this whole mineral depletion thing happening that's affecting the shape of our heads and our skulls and our mouths. And I say this and people are like, oh no, but it's super reversible. Like Weston Price reversed it. He has one case study where a mother had 6 children. 2, she ate the indigenous foods of her culture, and it was a lot of like meat and dairy and no processed foods. Beautiful teeth, beautiful structure. You can see all the pictures. The next 2 kids, she fed them canned foods, and it was about the time that the army was starting to supplement certain tribes in the area. So she was eating all processed foods. Their teeth rotted before they were like 12. Their jaws were like super recessed. And so the mom was like, well, I'm going to go back to my indigenous foods, and went back to her land-based foods. And the next 2 sons were back to like healthy teeth and really strong jaws.
Wow. That's incredible. I'm not surprised, right? I'm not surprised at all. Okay. So next question is, what is something, I feel like you just like pulled out millions of these things. What is something that most people don't know that you think that they should know about what you do?
Yeah, I think it goes back to just really understanding what pre and perinatal work is, and encompassing pre and perinatal work. We're looking at our own births. So, and how our own births are really important in the relationship between the births of our children. And that our own births are also protected by, we're in this generational line, and things that happened many years back that we might not even know about can show up in our current birth. And so just starting to understand and look, the way I treat and the way I think about things is like, what is happening in the whole field, not just your body and your birth, how that affects your child and your baby's birth, but also like what's happening back here, and what's that whole piece, and bringing that into treatment, into practice, and understanding that.
Amazing. Okay, thank you. Next question is there anything new special that you want to promote to the audience? And that can be anything that's you want to say.
Yeah, so I kind of started this thing, and it's slow going. I think it's just kind of getting some momentum, but the number one thing I hear from women in my office and new moms in my office is that they want a community, and they're looking for community. And I see different providers doing things throughout the areas. I know community is happening, but I'm trying to like funnel it into a place where it's like easy to see the different activities and the groups. And so I started a WhatsApp group for anyone in preconception to postpartum, with the focus of just getting to know like other moms in the area, other birthing people in the area, other activities, mostly like gatherings and circles. And it's a way to promote some more community, and it's been good. It's anyone's welcome. It's slow, but I was trying to find a way for moms and birthing people that don't want to be on Facebook and Instagram. And because that's the way that we often, providers like us, share our information and share about our classes and our courses. And so I'm trying to not use social media in that way and still create community. So WhatsApp was my solution. I can share that with you. It's just a WhatsApp group that anyone can join. And I'm always telling people, like, tell people about it. If providers want to be involved with me right now, there's me and another doula just recently joined to like kind of help share what's out there and hold that space. If anyone wants to start to be involved in that, to share their stuff, or like wants to support this community with me right now, I'm like, I'm doing this alone, but I want some help. So
well,
that's growing.
You know I'm in, right? You know I'm in.
Yes.
So send me the WhatsApp. Awesome.
Yeah.
Well, thank you for sharing that. That's a really exciting thing. And then my last question, the one question I love asking everyone is, what is the thing that you want to be known for?
Yeah, that's a hard question. It's like, it's the same question as like, if you had a stage and a megaphone, what would you tell people? It's like, I don't know. Yeah, I really think I mean, I include cranial sacral in this when I say this, but really that pre and perinatal somatics and educating and working with people with their own births to really help lead to better birth outcomes of their own children. Like, my dream and my goal is just to have better birth outcomes in a world right now that is so full of birth trauma. And I want to be known to support people that have had experienced birth trauma to work through that, or want to prevent birth trauma. And that's really what I want to be known for.
Amazing, amazing. Okay, Lesha, where can we find you? Website, social media, all the things, WhatsApp, list it all.
Yep. So my website's my name, leshanelson.com. Lesha is Lesha and Nelson, Nelson. My website, if you go to my website, it has like an email and a phone number, and you can find me through there. I am also on Instagram as Lesha_Nelson. And the WhatsApp group is called Nest and Nurture. And maybe contact Betsy too, because maybe she'll be a part of it. But the Nest and Nurture WhatsApp group. And if you want to be a part of that, you can message me on Instagram, or you can send me a message and I'll send you the link to be added to that community. And I guess the last thing I'll plug, I have a passion project I try to do once a month, a podcast. It's called Nurturing Resilience. And I just share resiliency stories, information. It's a very broad podcast, but it's a lot of fun.
Amazing, amazing. Well, thank you so much for jumping on the Spotlight series with us. Thank you for your time, and thank you for what you're doing in our community. This was so fun. I'll see you soon, though.
Yeah, thank you so much for doing the Spotlight series. This is awesome.